Health Cabinet Secretary Susan Nakhumicha is tonight inviting the striking doctors to the negotiating table to seek a solution to the current crisis in the health sector. According to CS Nakhumicha, the government is on course in resolving some of the issues raised by the doctors. Her plea coming as the doctors' strike entered day 23, with clinical officers and medical laboratory officers who also joined the industrial action mounting pressure on the government to yield to their demands. Safina Chiang Oma details this back and forth that is now turning out to be the biggest nightmare for the government, which is keen in the successful delivery of the universal health coverage.
The situation at Kapsabet County Referral Hospital, one of the large hospitals across the country, which has now been deserted after doctors downed their tools 23 days ago, followed by the medical laboratory officers and clinical officers who continue to mount pressure on the government to urgently treat what is ailing the health sector. Health Cabinet Secretary Susan Nakhumicha, who has been under pressure, was in Butere, Kakamega County on Friday, where she invited the doctors back to the negotiating table.
We may disagree, but disagree to agree eventually so that we ensure that Kenyans get service.
The CS affirmed that the government is on course in resolving some of the issues raised by the doctors.
Payment for postgraduate doctors, that we are doing today, so we'll have paid all the fee arrears. Posting of medical interns, that we are already doing.
Solidarity forever.
Her pleas seem to have fallen on deaf ears, with KMPDU officials who visited several hospitals in the North Rift region insisting that they will not be cowed into submission until all their demands are met.
You can suspend all the doctors who are home. You can fire all the doctors who are at home.
Fire us all.
But I must say, that will not change the resolve. Yes. We are in this as long as the government wants it to be. That the CBA must be implemented, the new CBA must be signed, and the intern must be posted as we agreed.
In Nairobi County, medical laboratory officers camped at Afya House, accusing the Ministry of Health of a lackluster attitude over the industrial action, which began on Tuesday last week. The laboratory officers are demanding for strict adherence of professional standards in employment to avoid infiltration by unqualified personnel, exploitative contracts, lack of adequate risk allowance, comprehensive medical cover, paid internships for medical laboratory students, and a recognition agreement.
We are here to push the ministry to call us to the table and discuss the issues that we presented to them. Number one, this union has been in existence since 2018 and it has not been given a recognition agreement.
The union leaders have issued a threat of a complete shutdown of all laboratory services effective midnight.
Those people that have been booked for dialysis, CS and or any other operations, we are withdrawing the services today midnight. Sure. All the HIV clinics will not be doing any viral load, any CD4.
This as clinical officers, through their union officials, vowed to sustain their strike, which entered day 5 on Friday, accusing the Council of Governors of disregarding their welfare.
The mandate of the Council of Governors is to coordinate issues that are touching on every county. But they have chosen to abdicate those responsibilities. They have gone to bed and it's like they don't know that exists.
So we have called upon all clinic officers across the country, and on Monday we are going to have a mega demonstration so that we can go to the offices and they can inform us the reason as to why they want Kenyans to suffer.
The clinical officers claim that all the 10 grievances they raised, including the implementation of the negotiated risk allowance, transitioning the UHC staff to permanent and pensionable terms, employment of more clinical officers, as well as lack of a comprehensive medical cover, have been ignored, while the union confirms that it has okayed the diploma internship placement offer by the Ministry of Health. They have directed the degree interns not to pick the internship letters, accusing the ministry of breaching the current terms of payment for the BSc clinical interns.
For those who are already ongoing, they are paying them as per the job group K. and now they are actually departing from that by virtue of providing to pay them 91% less of what they are earning. And we have said no.
We will use any available legal mechanism or otherwise to ensure that the salary for the interns is not going to be reduced.
The fate of thousands of patients across the country remains unknown, with no end in sight to the industrial action by the different cadres of healthcare workers who continue to mount pressure to the Ministry of Health to urgently address their grievances as the only condition for them to return to work. Safin Acheng Oma, Citizen TV, Nairobi.